Okay, good morning everyone and welcome to our first Time to Change webinar as part of our series following our 2020 annual Public Health Report. My name is Adele and I work for Public Health Suffolk and will be facilitating the event today. Now the Time to Change webinar series is co-designed with community members and leaders, and it aims to provide Suffolk organisations and communities with access to development opportunities to introduce and raise awareness of key terms and topics and approaches relating to health inequalities. Now, the event today is intended to start a conversation and gives us an opportunity to reflect on how this relates to our roles and what we can do to improve our understanding of health inequalities in Suffolk. So please do pop any questions you may have in our chat function and we will try and answer your questions within our Q&A section at the end of the webinar today. So why are we talking about ethnicity data? The focus of today's webinar is about the importance of collecting ethnicity data. We know in the past, data has often been collected in an inconsistent manner, resulting in incomplete data. Now, there are plenty of challenges and barriers with our current ethnicity data recording, and there's also been a need for better data recording that has been highlighted by both national bodies and within our community. So as part of our commitment to following our public annual health report, we are here today to discuss why it's important and how we can start that conversation on improving the way we collect ethnicity data moving forwards. Now, a big part of data collection is our terminology and our phrasing on how we describe ethnic groups and how we ask them questions on ethnicity. So on that note, I would like to introduce our first guest speakers, Shirley Powell and Imani Sorrento. Now, Shirley is a health and wellbeing lead for Suffolk Black Community Forum and the founder of Your Life in Your Hands. And Imani is a heritage and cultural lead for Suffolk Black Community Forum and the director of KMT Rising Limited. Now, they have recorded their presentation today as they couldn't be with us, but it focuses on personal experiences and explores inclusive language and terminology to be used and considered when the data collection process is reviewed. So I will now share their video with you.
Okay, greetings. My name is Imani Sorrento. I'm the Heritage and Culture Lead for Suffolk Black Community Forum. And we also have Shirley Powell, who's the Health and Wellbeing Lead for Suffolk Community Forum.
Hello. Hello, everyone.
So we really wanted to put this into context in terms of where our organization, our voluntary organization sits really in relation to the word BAME. And the Suffolk Black Community Forum would like to really insist that all government departments, public bodies, the media and others stop calling us BAME. I mean, this is an acronym which stands for Black, Asian and Minority Ethnic. And it's a term which we feel, actually does not suit us and it's not something that we owned. It's become more prevalent in use now, but however, as an organization and personally, we reject it. We do not, own it or embrace it as an organization. And we find because it does not reflect our unique and cultural specific issues affecting our communities By placing different communities and lumping them all together in this way, it negates our identity and our rich experience, our shared experience as a people of African origin. And the term BME in the past was something that we embraced a lot more because it had its roots in an anti-racist movement in the UK spanning over 50 years. It was a term that we collectively embraced because it also recognized that even though we were a minority here in the UK, we were and are a majority across the globe. So the term BAME is also masking the specific cultural nuances which affect some BME groups significantly differently to others, and also affects BME groups disproportionately. And we expect all statutory bodies to stop lumping ethnic groups together in this way, as though we're one homogenous group of people. As a people of African origin, our experience of the slave Holocaust, where over 100 million of our people were killed through the enslavement process, which we are still experiencing the psychological and economical and cultural devastation of today, which impacts on every area of our social activity, education, health, relationships. We cannot negate that, we cannot ignore that. And it's a part of our rich tapestry that makes us who we are. And so with that said, we reject the term BAME, and to group us and brand us in this way is demoralizing. It's not acceptable to us, and we want it changed now. So Shirley, yeah, interesting debates about BAME.
Yes, nice to meet everyone. I'm Shirley Power, Health and Wellbeing Lead, as Marnie has just said. I echo what Marnie has said concerning the name BAME. It's like, when I've looked at personal experience, I tend to see as boxing us into a category. I know when I've had to complete forms myself, even with the recent census that we had to complete, you see the box that says Black Other, then you see the box that says Black Caribbean, then you see the box that says Black African or Black British, and then you think, well, where do I put myself? Because I'm Black British because I was born here, but then my parents Black Caribbean, but then we are all of our origin of African. So where do you put yourselves? That causes a lot of confusion, having
So.
all of these different categories. And one of the things is I wonder when whoever puts these forms or collates these forms, do they actually speak to somebody of color to actually ask them what they want to be called? Or do they just think, oh, well, we'll just put down that? I've had that in other forms that I've filled out as well. And I've had other people tell me the same experience. Where do they put themselves? Then you've got the people of mixed heritage, and where do they sit? Do they put themselves as Black Other, or do they put themselves into something else? So
we're always told
confusion.
that categorization is really important for our specific needs to be met, or for there to be improvements in relation to healthcare, for example, and so on. And we have been using this categorization for the longest while, and nothing has changed in terms of our experiences of inequalities in health, in education, etc. So it's not working for us, is it?
Even from personal experiences, in health, and I'm a nurse of 36 years, and I've known along the line I've had, because of my color, I have been told, well, you won't fit in here. I've actually been told that.
Oh, wow.
So there's this thing here because of your color, and I've also had patients that when they've listened to me, because somebody's can't see very well, if you close your eyes and you listen to me, you would think I was somebody who was white, and they would say, oh, I wouldn't have one of those in my house. So this has a lot of issues, and it stirs up a lot of issues, and really it's part of our identity, it's part of who we are. So it's really important that this is right, that they get this right.
It has to, we have to get it right. Exactly. It cannot be insulting to a group of people and we just carry on ignoring the fact.
And some of the Black brown communities that we've spoken to have said they would rather be called brown and brown and Black communities as opposed to BAME, because we are a people of color made up with different shades of brown and Black in the community. So they'd rather have that than to be called BAME, because
Yeah, because absolutely. I mean, it's our visibility that is the issue for many people. You know, yes, there's different levels of discrimination across all minority ethnic groups. Let's not. I don't want to, you know, negate that and put and undermine anybody else's experience. You know, white minority ethnic groups as well. They are also, you know, affected by disproportionately by a lot of things that's affecting healthcare and education. However, but the needs of the Black community, when you look at the statistics, we are for, you know, this area is actually really grossly and disproportionately affecting us in all areas of life: finance, education, health. And it's because of our visibility. So let's not ignore it. Yes, I'm Black.
Yes.
And it's not something that I want to hide. However, you know, let's treat everyone equally, even though we are all different, you know. So we don't accept the word BAME. And what we're asking for in East Anglia and Suffolk is that you consult with us, the Suffolk Black Community Forum, consult with us so that we get it right.
Yes, definitely. So that you know, we have a say in how we are going to be called, because it's part of our identity, and it's part of our culture, and you know, all of that. We want to make sure that the correct data is logged as well.
Yes.
As it is, because if I'm my personal experience is finding it hard to know where to put myself in which box, then how is you going to have correct data? You're not, because I'm sure I'm not the only one that has that problem, thinking, well, where do I put myself? Do I put myself here? Do I put myself here? And if you're wanting correct data, then this is something that needs to be explored.
Yeah, and absolutely, and we do expect in the next few years that we can have this correct data, because it's been about 20 odd 30 40 years 50 years that the surgence of people from the Windrush community have been here. And yes, as an organization, when we ask for data in relation to healthcare, in relation to business, people say we haven't got it. we haven't got this data in Suffolk.
Exactly.
Come on now, we have to get better at this.
Definitely.
So yes, you know, the Suffolk Black Community Forum is saying no more BAME, and consult with us to get it right. Thank you.
We want to take this time to say thank you for listening to us, thanking you for hearing our voice as a collective group of Suffolk Black Community Forum. Thank you.
So apologies there if you did see the video freezing, but I hope you could all hear the presentation. I just want to thank Shirley and Amani for their presentation, as they have said many powerful and key points for us all to reflect upon. I know here in Public Health Suffolk, we have been working with our integrated care system partners and community leaders specifically on how we ask them questions on ethnicity as part of our vaccination programme. And we recommend all organisations to adopt the phrase, which ethnicity best describes you, when asking these questions. Now, we have developed a prompt sheet specifically for the vaccination programme, which will be available to view on our website as a resource that you can adopt in your organisations. We will also put a link to our public health terminology guide, which goes through some of the languages and phrases such as BAME, as Shirley and Amani spoke about, and suggested alternatives that you can adopt. Now, I want to keep hold of your thoughts on data categories, as Molly and Tristan will be discussing these later in the presentation. But one factor I think is important that was mentioned in the presentation was about engaging with our community about data. So when we were co-designing our prompt sheet, I spoke to many members of our community, and it was highlighted that it was important to have good practice examples of how data has been used to support ethnic minority groups. And Shirley and Amani did mention that we don't often hear about how this data has been used. So on that note, I am delighted to introduce Tim and Louise, who are going to discuss why ethnicity data is important nationally and how this data has been used to inform decisions. Now, Tim and Louise are both census engagement managers and are working closely with councils and diverse communities to research, develop, agree and implement a local engagement plan to achieve a successful Census 2021. So the floor is yours, Tim and Louise.
Thank you, Adele. Good morning, everyone. I've kept my camera off just to avoid it freezing. But yeah, we're here today to talk to you about Census 2021, the process we've just been through, and talk a little bit about why ethnicity data is important and how it's been used to inform decisions in the past. I'm on the call. Louise was also on the call. We were census engagement managers covering Suffolk. So I covered East Suffolk, Louise covered West Suffolk. The census engagement manager was a new role for 2021 census, just so we could have more of a hyper-local approach to dealing with community groups. And I think it's been a fantastic success in terms of the groups we've liaised with. Our intention really with this census was to make it as inclusive as possible, so that would then broaden understanding of modern society. And I think you could argue never has been, it's been more important to understand how society is faring than at the moment, during a pandemic. So really the approach we took to make sure that we were as inclusive as possible was to tell people about census, but to tell them about it in a way that they wanted. So perhaps in a language that they wanted. So we had about 50 different languages that we had census material translated into. We attended lots of different community groups and spoke about the census. And we allowed people to complete the questionnaire using language guides, so you could translate the guidance on the website using Google Translate and automatic translation tools on the website, and also post-census. And we were helping people to complete via our call centre, who had a translation service available, and also lots of FAQs in different languages. So we try to make it as inclusive as possible. So that's just a bit of an overview of what I've just gone through. So I think the key point was really we were asking people to identify how they wish, in particular under the ethnic groups settings. So the main ones: white, mixed, Asian and Asian British, black and other. Underneath all of those groups were subgroups. One of the new ones under white was Roma, so that was actually added as a subcategory. But under the black group, it was obviously the Caribbean, African and other. And under other, we were giving people the opportunity to self-identify, so they could type what they wished, both on the electronic questionnaire or on the actual form. So I think just to give you a bit of historical context, we've been capturing ethnic group data since 1991. The data has been used to allocate resources in central government and local government. It's informed policy and helped organisations understand how they're doing against their obligations under the 2010 Equalities Act. Locally, myself and Louise engaged with a lot of organisations. So Healthwatch Suffolk, who have a forum, Ipswich Community Media, who have got deep links into the community, Suffolk Refugee Service, who've been doing a fantastic job supporting us, helping the refugees and asylum seekers complete the census using Arabic and Kurdish language guides. ISCRI we worked with, and the forum, the BAME forums. I know just had a conversation about that terminology. The SCC Equalities and Diversities lead we met with as well. So I think it just gives you a bit of an understanding of the groups that we met to give us a good opportunity to engage with everyone. So examples of the impact of the census data. So the BBC have been using census data for their diversity monitoring and understanding their programming, and is it hitting all of the audiences they want it to hit. The NHS have used it for workforce planning, and the civil service have used it for best practice and monitoring their equality and diversity. In terms of case studies, there's one from the Bangladeshi community. So we had a member of the Bangladeshi community working for us. And I think, this was a lived experience. She told us about why the census was important to her and her community, as it was putting down a marker, making sure that they were represented in society and given credit for the difference that they've made.
So, hi everyone, this is Louise Carson, Census Engagement Manager for West Suffolk. So, picking up around the issue of COVID-19 and in ethnicity, that information from the 2011 census has already been crucial in our understanding of mortality for the different groups during the pandemic. So, it's with the fresh data that we're going to be getting from 2021 census, we'll be able to update the analysis, and we'll use it alongside new data sources to give us the richest data we've ever had. And so again, Tim was talking about a case study. So we've been working closely with lots of different communities, and we have recruited people from communities to work within them. So we've had people from the Somali community working within their own community. We've had a census community advisor for the Black Caribbean community, from the Pakistani community, the Black African community. So we've recruited census community advisors to work within the community and show how important it is for them to be counted. So just looking at the Somali community here, that in 2001 census, there were just over 43,000 Somalis. In the 2011 census, over 101,000 Somalis. And in the 2021 census, because there has been more opportunity to self-identify, and census engagement managers like Kaltun Fadal from the Somali community, we've been raising awareness and showing how important it is that people get counted, and we're listening to people as well with what's important to them. The next slide. Another case study, which I actually used in Newmarket, because I've been working with different groups within Newmarket, and so I used this case study from the Muslim Council of Britain to explain how important it is that people get counted. So, for example, census data was used to get more Muslim chaplains in NHS hospitals. And so that was important when I was working with the Islamic community in Newmarket and other areas, showing them how important it is that, for example, more imams are now working in the NHS because of the census data that was used. So thank you, everyone, for listening, and hopefully we will get some really great data from this census going forward.
Perfect. Thank you, Tim and Louise. And that, like they said, a lot of resources has been disseminated across Suffolk for the census in accessible formats. And it's great to hear of that approach of working with the community rather than a working for, as it allows us to shape and gain insight into how we collect and provide resources. And if you haven't already done so, please do complete the census or encourage people to fill out the census if you haven't already done so. So for those of you that don't know, the census is collected every 10 years, but in Suffolk, we have been looking at how we collect ethnicity data on a more regular basis to help inform local decisions. Now, these decisions can be both at an organisational level to help inform internally in your service, but also how we start to look at the system as part of the Time to Change series. So without further ado, I'm pleased to introduce David, who is the diversity lead for the integrated care system for Suffolk and North East Essex. And he's going to talk about why data is important locally with a focus on health inequalities.
Good morning, everybody. I'm sorry about that noise. I live on a boat and a noisy boat has just gone past. My name's David, and I want to talk to you about why we collect health data. And I suppose the first thing is that is relevant is epidemiology, which is the study and of how disease occur in different groups and why, so that we understand it and we can understand the disease risks and we can prevent and reduce the impact. But we also collect these figures to improve diagnosis, to develop new treatments and prevent disease. And as we just heard as well about planning NHS services and improving patient safety. But also government, we've just heard, want to analyse and want to create policy around this. So next slide, please. When we do collect data, we find differences and they will affect the outcomes. So pathogenesis, which is basically, if we all were the same, then treatments would all be the same. But as it happens, we already make differences and allowances for the fact that there's different effects on male and female, young and old. So it's important that we understand what the differences are. And there are some very clear differences in ethnic data and how diseases and illnesses affect different groups. So that's why we need to take notice of that. We need to organise effective treatments, and responses to treatment vary across the ages, sexes and races. We need to be culturally sensitive so that our services are appropriate and that we have languages in place and make it accessible to everybody. Next one, please. So we know that people from Black and other minority ethnic groups are up to 6 times more likely to be diagnosed with type 2 diabetes, stroke, and 50% more likely to die of cardiovascular disease. Now, I'm just going to give you a bit of personal input on that. Within my family, my elder brother, my younger brother, and my father all suffered with strokes. And luckily, my father was a health educator. And we spoke about this when I was about 20, because that's when he was having his strokes. And at that time, we started talking about reducing our salt intake, living a more healthy life, and obviously not being too stressed because it was affected by our blood pressure. So now, because of that information, at my age, 55, I have to take 2 pills every day, which staves off my stroke. So it's important that we know what the differences are. And if there is a higher increase of something, then we need to try and counter that for the sake of everybody. Now, we can use the knowledge to consider intervening to prevent ill health amongst adults from minority ethnic groups at an earlier stage. And I really think that if I hadn't have had those conversations with my dad in my 20s, I probably would have had a stroke by now. So next one, please. The benefits of gathering this data are enormous. We can use the data to inform your services and monitor improvements locally. We can improve the experiences of using health and care services locally. And it allows us to understand the needs of our community better. It also allows us to celebrate diversity. I mean, I don't want to live in a world where we're all the same. I like the fact that there's lots of differences and that we don't all walk down the street looking exactly the same. Taking part in and giving data allows us to update the census. Now, the census is only collected every 10 years. And in some areas, 10 years, lots of things can change. I was looking at all the figures coming out of Hackney, and a lot of the figures for COVID were saying that Black people in Hackney weren't coming forward to be immunised. Now, the problem with that is that actually Hackney has changed so much in the last 10 years. So many of the Black community have actually moved out, and new people have moved in, and I'm not sure that's been reflected by the figures that are being judged against what's happening right now. So obviously the census is important, but it's also important that as health professionals and as those working with people, that we also encourage people to take part. So next slide, please. Now, COVID-19 has highlighted the real need to understand the data and differences. In England and Wales, males of Black African ethnic background had the highest rate of death involved with COVID-19, 2.7 times higher than males of white ethnic backgrounds. Now, admittedly, there might be genetic and physical reasons why that's the case, but there are also definitely social reasons as to why that was the case. So we need to judge these figures against other data that we have so that we can target people and make sure that the right communities are being targeted. Obviously, there's other information on that screen about females of Black ethnic background having the highest rate, 2 times higher than females of a white ethnic background. Next one, please. So using more detailed ethnic group categories and adding measures of pre-existing health conditions from hospital data, we've been able to build on previous analysis of ethnic disparities in COVID-19 mortality. Today's report confirms that when adjusting for age, rates of death involving COVID-19 remain greater for most ethnic minority groups, and most notably for people of Black African, Black Caribbean, Bangladeshi and Pakistani ethnic background. Just during the vaccination process, I was speaking to people from the Bangladeshi community who knew 7 and more people who had died. And so it's, you know, the way this plays out in communities is huge. So we have to try and counterbalance this. So how have we made a difference from what data has told us? Well, I'm pleased to say that in the ICS in North East Essex and Suffolk, we put on specialist clinics and other measures regarding COVID immunisation. We worked with community leaders. We asked them how they felt we should run these clinics, and we made adjustments. We made adjustments for language as well, and tried to make sure that there were community leaders around to be able to interpret for those that needed it. Next slide, please. But there are lots of barriers to break down. There's fear of prejudice in their interactions with staff or treatment in the future. Now, we found that some white people didn't like asking that question. Some white people didn't like being asked that question. But we really, it is our responsibility to ask the questions. It's up to people if they answer them or not. Another barrier is awareness of stigma associated with some characteristics. There are going to be reasons why some people are very scared about having data taken. I'm sorry to be political, but you know, you could have someone like a previous president of the United States taking over, and that data would be there, and people would worry about things like that. So we have to give credibility to those concerns. There's a fear of being refused treatment or pursued for payments. We all know that there's been a hostile environment for people who are not meant to be here. But even so, those people, we still needed to make sure that they were immunised. And there's a fear of information being shared elsewhere. That's immigration. And general poor experience of authority and service and mistrust. I'm working with communities in Essex, you know, who are saying that they've been ignored for a long time. So it's important that we do listen to the communities. Next slide. Okay. That is my next slide, which was the end. No wonder I had nothing more to say. Thank you very much.
Perfect. Thank you, David, for your presentation and also sharing your personal story. And I think on one of your slides, you do raise a really valuable point, which wasn't mentioned, but it's about ethnicity data, and it's not mandatory. But if we do not know this data, we can't then start to look at health inequalities that exist locally. And I hope within time we can start to break down some of them barriers you talked about, and would ask sort of all organisations to consider both actively engaging with them communities and on collecting ethnicity data, as well as starting to think about how you can collect ethnicity data within your own organisation. So on that note, I would like to introduce Molly Thomas-Mayer and Tristan Childs. Now, Tristan is an experienced researcher who works in the analytical team at Public Health Suffolk, and Molly is a public health doctor at Suffolk County Council.
Oh, thank you, Adele, and hello, everyone. It's really lovely to see so many people joining the webinar. So I'm going to present a few slides, and Tristan, who is the data expert extraordinaire, will be on hand to answer some questions if you have any towards the end of the webinar. So yeah, as Adele said, we have talked about the importance of it, and I think that's been wonderfully illustrated by the speakers earlier today. But there are some of the questions about how do you actually do it, and it's not just necessarily a case of the statutory organisations. We know there are lots of many local organisations, voluntary and otherwise, and getting their agreement to collect some of this data would be hugely beneficial for our local services and local understanding of our communities across the region. So here's a sort of some suggestions about how you might go about it. And in effect, sadly, it is a really complex area. there are lots and lots of local systems available. You may be joining this webinar being already familiar with some because of the work that you do. They all have different purposes. And they all collect the data in slightly different ways. They are hugely varied, and more annoyingly than ever, they don't actually align. So it's really hard to use one set of data and compare it with another, which is endlessly frustrating. Just to give you a bit of an illustration of that, so we looked at system 1, which is one of the GP data collection software available. And for ethnic groups, it identifies as many as 136 codes, people identified in those groups for the people in Suffolk. And it includes many which you then can't simplify down to some of the more standardized classifications. So, for example, people might be listed by their country of origin, or they might be listed by their religion, and then there's no mapping across to help service commissioners understand actual numbers of people in those groups, which then makes service commissioning really complicated. Next slide, please. Thanks, Adele. So recognizing that there are lots of systems and lots of ways that this can be done, and also definitely acknowledging the sense that no system is perfect, the one that we would recommend is the ONS categorization. It is based on 5 sort of major groups that you can see in the bold, and then that is further split down into 18 subgroups within those. As I say, recognizing that these are boxes for people to kind of sort of identify with as best as they're able, and recognizing this is not perfect, but this is the most standardized and well recognized and used system that we have available nationally. And how might you go about doing this if you're running a community group, or you're involved in you could be involved in this data collection for the service that you are running? So we recommend that you think about doing this for all users of your service, and to include it as a routine part of the information gathering you do when people register. So as you would take their address or their date of birth, the ethnicity questions are also included. We also recognise this might be a plan going forward, but think about potentially going to your existing clients and asking them for this information, and also the reasons why you are doing that. I think from some of the speakers today, it's been very, I hope it's been quite clear and understandable why this information is really useful and helpful. The other thing I think that puts people off from this is that they are worried that they need a very complex software system. You absolutely don't. An Excel spreadsheet will be perfectly okay for this purpose. But the key thing to say is you need to keep this information as secure as you would any other person identifiable information. So, for example, you will store sensitive data in a secure location, so it can only be accessed and edited by those that have been authorized to do so within your organization. And you might ensure that it's appropriately encrypted if being moved out of the secure folder, or if it's being sent on. So some further pointers as well. So as I've mentioned a couple of times, people justifiably feel that many of the groups and the categories that exist don't particularly well represent how they think of themselves and how they identify themselves. So another suggestion that we're making today is that you can also consider a 2-step process. So firstly, you ask someone how they would identify themselves. So a bit like Adele mentioned earlier, you ask the question, which ethnicity best describes you? And you allow people that sort of self-identification first of all. And then you would present them with the 18 nationally used categories that I showed in a couple of slides ago, and then ask them which of those they think best represents how they would identify themselves. And it's perfectly fine for you to say, we recognize this is not perfect, and you may feel you actually fit into a couple of, or 2 or 3 of these groups. And then you're able to align these categories. So people would identify themselves, and then they identify their category, and you work with people people to work out which is the best option for them. You might also think how to enhance this work. So, for example, you could include their language preferences, and that might help improve service delivery. For example, having material translated into appropriate languages for people to access and use. So, in summary, it's really important that the language you use on ethnicity is inclusive. As Imani and Shirley so brilliantly described, it's so easy to make people feel left out and alienated and that this is not for them. But as David showed, there are huge benefits for us understanding the services, which was how to design services that adequately represent the community that we live in. We need to really engage with communities on this on every level. And so what we would really recommend and really hope that you get from this webinar today is for you to start to look at how you collect this ethnicity data in your organisation. So thank you very much.
Thank you, Molly and Tristan, for that insightful overview of how we can collect data in Suffolk, including how we could possibly overcome them challenges, looking at that two-step approach. So at this time, I'd like to take the opportunity before we move to our Q&A section, just to share some information with you. So please do let us know your feedback and thoughts on today's webinar by completing our 60-second survey, and that is posted in the chat. If you do wish to get in contact about any of the topics in our webinar today, please do email me directly. My email address is on the screen. And also do please keep an eye on our website in the upcoming weeks for the recording of this webinar today, as well as the further resources and links we spoke about during the webinar. So on that note, I would just like to thank all our presenters today, and at this point we'd ask them to turn their cameras on just for the Q&A section.